working? Okay. What do you do with this guy?
What do you guys do for a speaker for him?
I can talk louder. Can you hear me now?
Yeah. Yes.
All right. I don't know how long that's going to last, so enjoy it. So as I said, I'm Dr. Allison. I'm from Cleveland Equine Clinic. I have been a vet for just shy of 13 years. I'm from this area, so I probably have run into a lot of you at shows. I may work for some of you. Some of you may have said bad things about me, but there's probably some sort of relationship somewhere in there. So just to give you a quick rundown about today, it's about vaccines. So we're going to go over a little bit what vaccines are, why we use them, ones that we think are important and why we think they're important. There'll be some kind of on the side, off the wall ones. If we have time, it's kind of a long PowerPoint. When Dr. Paradine did her talk, she gladly took questions during hers. I'm going to say don't do that because I'm sure everyone already has a list of questions. So write them down if at all possible, and we will try to answer them at the end, because otherwise I like to gab a lot anyways, and you'll be here till tomorrow, I guarantee you. So you know, the first question that comes to mind when we start talking about this is, why do we vaccinate? And I tried to figure out a good way to answer this question that made sense. So thinking for a while, I thought about this guy. Do we know who this guy is? Very good. Do you know why I would have a picture of him up here? Okay, you get half credit. So this is why. He did nothing with viruses. He did nothing with vaccine. He's known for a lot of other great things. But he also had a lot of good quotes. And one of them is, an ounce of prevention is worth a pound of care or cure. And I think that's really the mainstay of why we vaccinate, and a lot of things we do with horses, truthfully, but particularly vaccines. I like that. I thought that was really witty. But so what is vaccine? There is a very large paragraph up top that tells you what the Encyclopedia Britannica says. But basically what it is, it's a weakened form, a killed form, a modified form, or part of a toxin of a bacteria, a virus, a fungus, that they make into a vaccine that will help hopefully mount an immune response in a horse, but not actually cause the disease. That's the important thing. You want an immune response, but you don't want the disease. That's kind of counterproductive if you give the horse disease at the same time. Like I said, you can read the paragraph, but it's kind of a lot, and I don't even understand it. So what are the main things that we typically protect, or I'm going to use the term treat? Now, I know when we think about vaccines, we don't think about treating things, but there are a couple things, like I said at the end, that'll make more sense. So we got viruses. You know, things that we think about are West Nile, herpes, Tripoli, Western equine encephalitis. There's Venezuelan equine encephalitis. Back in the 60s and 70s, that was more of a problem in South USA. Going to Florida, a lot of people would vaccinate for that. Fortunately, that's not one we have to deal with as much anymore in the United States. Bacteria, things like tetanus, strangles, botulism. Fungal infections, more of, again, a thing in the South, like in Florida. There's a certain disease that horses can get that they can use vaccines for. And then melanoma. Some of you might know where that's leading, but if not, I think you'll find it kind of fascinating. Just quickly, like I talked about before, this is kind of a little bit more in depth, but there's different types of vaccines and how they're made. Some of them, they're live, but they're weakened. So again, they mount that immune response, but they don't actually get the disease. Modified live, which is a similar situation. Toxoids. That in particular is like tetanus. So tetanus, they actually use the toxin that bacteria makes that does all the bad things in horses and tweak it, and that's what causes the immune response for horses. Recombinant, again, just different types of how they tweak them so they shouldn't cause it. Like I said, they may be killed, they may be modified, they may be even fragments. So it's kind of like you threw it in a blender and took out the pieces you know that would cause a response but wouldn't actually cause a disease. Vaccine companies put a lot of money into making these. This is not cheap for them to do. And they have, over the years, improved the quality of their products, so hopefully there's less reactions, but more importantly, the quality of the immune response is better. You know, it used to be, some of these companies use something called superfiltration, so it used to be like, if you had a big filter, you would throw everything that you wanted to vaccinate through that filter, and hopefully it caught all the stuff you didn't need. Now companies have things like called superfiltration and other dynamics, where what they do is they have a filter for each and every individual disease, which, if you will, kind of makes it a cleaner form of making a vaccine, because you're only catching what you need and you don't have all that other stuff in there. A few facts that I think are important that we need to all remember about vaccines. So first, vaccines do not prevent an animal from getting a disease. That's not how it works, just like in people. The hope is that it minimizes the risk and the severity of that disease if they were to contract it. This is another big one, especially if you buy a horse and you don't have a vaccine history. The longer a horse goes without its scheduled vaccines, no matter how many times a year that is, their immunity will drop. And to a point, they will almost become naive, like they've never been vaccinated before. A lot of people in this area do eventing, hunter jumpers, dressage, so off-the-track thoroughbreds are a really big thing around here because we have a lot of animals to pick from. When I do pre-purchases on these horses, we ask about vaccine history and things like that. Typically at racetracks, all you need is flu rhino. So influenza and EHV 1 and 4, that's it. That's all they require. So you should assume that they've never had any of those. So when I have people buy a horse, I say pretend it's never had a vaccine in its life, which means they get the original vaccine and they get however many boosters that are required. You won't hurt the horse by doing this, even if it had its other vaccine a month ago and you didn't know it. It's better to give them almost over-vaccinate, if you will, than not do it. Let's see. Again, typically vaccines require a booster. Just because you give the first one doesn't mean you get to fall off the list and then don't remind the vet to come back and give your other one or call in to schedule it. If you only get one, that doesn't count. And remember that there is not immediate immunity when you get vaccines even after the booster. Depending on what literature you read, it's 1 to 3 weeks. So somewhere in that area, you should assume that that's when you're actually going to start to get your immunity. The other thing to remember is to kind of time your vaccines with the season. So particularly in the spring, we always push people to do the ones that are passed by mosquitoes, West Nile virus, Tripoli, and Western. Because those are mosquitoes born, you want to catch it before the weather starts. So you don't want to start vaccinating in June for those diseases. They've already probably been around potentially. With the world changing as it is, regardless of what's causing it, let's be honest, the winters in Ohio are much more mild than they used to be. When I was a kid, it was 3 feet of snow and it was cold for 4 months and it was great. Now you might be 70, you might have snow. I mean, you just don't know what you're going to get. I was at a call a week or two ago in a short sleeve, and the people had a bog behind their house and there were mosquitoes everywhere. So that was in February. So I actually have some clients that are backing up their vaccines and making them more early spring, or say you're traveling. My wife takes a bunch of horses to Florida while I stay here in the cold. It's nice, isn't it? It's love. But I make sure I vaccinate her horses early because they're going to go to a place that has warmer weather and those things are already going to be out there. And these diseases are out there. Florida just had a Tripoli within the last month. So you always think, well, you want us to do these vaccines, but God, is it real? Hold on. I did this morning. Where'd my piece of paper go? Oh, no, I lost it. I made a list of the diseases that just happened in the last month. Now I can't find it. But Tripoli was just in Florida. Equine infectious anemia, where we check your Coggins. Texas, Canada, and I think it was maybe Utah had them, and those are always there. That's every year. Rabies, there was just one in South Carolina, I think. And there is typically a rabies multiple times a year in Pennsylvania. I know that because I'm licensed there, so I get a quarterly report from them. Those are real diseases. Western I haven't seen yet on the list. There was a West Nile in some places. We all know about the herpes currently going around. So these things are real. These aren't things that we just want to vaccinate for fun and take a couple bucks from you. There is a reason that we do them. And although they may not happen every year, have you noticed, for the people that have been around for a while in this area, we really haven't had equine herpes neurologic form really to this severity for a very long time. So sometimes these things cycle, so you can't just pick and choose when you're going to vaccinate and what you're going to vaccinate for. I think that's very important. Again, as some of us have learned through vaccines, sometimes they are, you can have reactions. You have to understand, though, too, there is supposed to be a reaction. You're trying to mount an immune response in the body. So some swelling, some heat, things like that does not mean your horse has terrible reactions and that you shouldn't ever do them. Now, if your horse in the first 30 minutes tries to die, it can't breathe, it goes into anaphylaxis, yeah, maybe we should rethink your vaccination program. But those are very, very infrequent. That leads me to my next point. I think every horse should be vaccinated in some way, shape, or form. One of the assurances you have if veterinarians do it is a lot of these companies, if a veterinarian does it, you get kind of an assurance or a warranty, if you will. If your horse has a severe reaction, you tell them about it and it's documented, they will a lot of times cover costs of treatment. If your horse has a suspect disease that you vaccinated for, sometimes they will do free testing. If you actually get a disease, and again, you have verification that it was done by a veterinarian, they will sometimes cover treatments to a certain degree. So they do want to help you, and they do have a lot of, I think, hope that what they've created and spent these probably billions of dollars on actually works. These two websites down here, which are easy to find, but AAP, which is the American Association of Equine Practitioners, has a great website that you can go through a lot of the different diseases that we find commonly in the United States. It gives you different guidelines for vaccinations. It even goes into some things about isolation, quarantine, and how you deal with the disease in theory. The other really nice one of wherever my paper went that I lost, it's EDCC, which stands for Equine Disease Communication Center. If you type in EDCC, you might get Edmonds College. That's not the right one. Don't go to that. I don't know why it does that. But it's a great website, and that's where you can actually look up alerts on diseases that are reportable in the United States. Everything from equine infectious anemia to herpes, I mean, everything that we vaccinate and things that we don't because it's not in this area. So it's nice you kind of get a lay of the land of what's happening. And again, they have some great resources about the different things we vaccinate for, what they cause, how to deal with them. I believe that website is actually like a subsidiary of AAP, but don't quote me on that. But it's a really nice website to use. So we kind of break our vaccines into two areas. There's what we call core vaccines, and there's what we call risk-based. So core vaccines is ones that we think are utterly important that you need. Either there's a high risk to the horses or a high mortality or morbidity. There's a risk to us, say, i.e. rabies and things like that. There's a couple other ones we'll talk about. It may cause a severe economic damage to the area it's in. If you get, say, a racetrack sick full of horses, like that will adversely affect the economy. The amount of money that flows through just Ohio, because we are one of the largest horse per capita states in the United States, believe it or not. I think we're top 5, which you don't think about it right away. You think about Texas, Kentucky, Florida, but when you start looking at the numbers, there's a lot of horses around. Look how many people in this room right now for this talk. So there's a lot of things that they look at. And this is usually what I fall back to, because inevitably the question, I go to a farm where people maybe aren't up to date on vaccines, don't have a lot of knowledge about them. The first question is, what ones are really important? And I immediately in my head, I'm like, all of them. Like, that's why we have them. But core vaccines are probably the most important. So again, that includes West Nile, Tripoli, Western equine encephalitis, tetanus, and rabies. These can have a severe effect on the horse, as in they don't live after they get them. They have some zoonotic potentials like rabies. And the other thing is these horses that can contract these diseases don't have to go anywhere. So the people that have the backyard barn with 2 horses that have never left their property in 30 years, these are the ones that they should really have, because you don't need another horse around. You don't need anything else around to pass these diseases. But some of those risk-based ones are also not bad to have in mind, because your horses may leave, but does your horse have a farrier? Does your horse have a vet? Do you have friends that have horses? These things can transmit diseases. Now, it's not common, but it does happen. So you always kind of have to be thinking 3 steps ahead in this situation. So core ones are the ones I always tell people you need to have. These are very important. We just talked about all those. Risk-based. The 2 most common ones that you'll run into typically is influenza and herpes 1 and 4. That's usually in your spring and fall shots. Those are biannual. Potomac horse fever. When I first started 13 years ago, Potomac horse fever wasn't really a big deal in this area. I went to Michigan State for my clinical year, and they assumed everything had Potomac horse fever depending on what time it was, of the year. If you called in, you immediately had to treat for it. That's just what they told you to do as a referring veterinarian. It's better to treat for it and not have it than don't treat for it and then you run into problems. But in this area, what you think, Dr. Perline, last 6, 8 years, we've had more, and this is not just our practice, this is practice in the area, more confirmed cases, more horses that are anecdotally treated and they respond rather well. So it is a real problem. And it's I wouldn't call it an emerging disease in this area, but it's something that we try to put into our program more often. Strangles, there's some debate about that one, but that's another common one. Botulism, fortunately in our area, it's not a thing we have to deal with that significantly. You go into PA, Kentucky, and places like that, it's more of a problem. Leptospirosis, again, not typically a problem around here, but it is a zoonotic potential, which means it can be passed from the horse to us. It's the one thing nice about large animals and horses. We usually can't get that much stuff from them, but the ones we can get are really naughty, so we try to avoid that. Kind of farther off on the spectrum, anthrax, rotavirus, snake bites, Venezuelan equine encephalitis, which I mentioned earlier, and EVA. Anthrax does live in the environment, particularly out west, so that is something that they deal with and they will find naturally. I'm sure some of us remember, I don't know how many years ago, I think it was in high school when there was all the anthrax threats and things like that in the Capitol and things. So, but this can be found naturally in the environment. Just a quick spot on broodmare vaccines. We're not going to get real deep into all this. If you have more questions at the end, we can. But specifically, they usually get EHV1 or what's called pneumabort. If you have a mare that's in foal, it's given at months 3, 5, 7, and 9. And then prior to foaling, usually a month or so before, we give them what we consider like our full vaccine program to the mare. So hopefully that gets passed down to the foal. So just kind of a quick side note. So we're not going to spend too much time on that. So this is our protocol for Cleveland Equine. I would say that most practices around us have a very similar program, if you will. Maybe there's slight differences. Maybe they may do it at different times of years. You know, you don't have to do all these in the spring. A lot of people do. We do most of these in the spring. But I know some people that want to have their rabies, et cetera, in the fall, so it's broken up in the vaccine schedule. And that's fine as long as you have it annually. So Potomac horse fever, that's an annual one. But you can actually give that a couple times a year if you'd like. Rabies is annual. Eastern and Western encephalitis and West Nile, again, those are ones that we really push for the spring because those are mosquito ones. So you want to make sure you have them before the mosquito season starts. Herpes 1 and 4, that's a biannual one, so twice a year. Influenza, biannual. Tetanus is annual. I have the asterisk there because it's an annual vaccine. That's what AAP says. That's how we do it. That's how the manufacturers say it. But if you have a horse that has a wound, if you're going to have some sort of surgical procedure and you're outside of 6 months from that initial date, we typically like to booster them. It's like a $13 vaccine. It works very well and it saves you a lot of heartache. So it's a pretty common thing. Or if I get there and the people are like, I don't really remember, it's going to be today. Like that's as simple as it goes. So it ain't going to hurt them. So what we're going to do now is I'm going to kind of go into each of these diseases that we vaccinate for. I'm going to kind of talk about the disease itself, some of the clinical signs and treatments if there are any, which some of these don't have a lot of specific treatments. The point of this is not to make you afraid, it's to make you informed so you understand these diseases and kind of the hardships that can come with them, but also how there's a lot of ubiquity between them, especially like say the mosquito-borne, they all kind of look the same. Actually, a lot of these neurologic ones all kind of look the same. So when we go out to see a horse, there's a list, and that list isn't easy to just knock down right away. So that's why we're careful, that's why there's testing, and that's why there's protocols. So we'll start with West Nile, obviously a virus because it's in its name. This is actually the leading cause of a certain specific gene or a species, a borovirus of encephalitis in horses and people. You can get West Nile virus. I think when I was in middle school, I had a teacher that got it. So we used to have a bigger problem in Northeast Ohio, but it is real, and this is a disease that you can catch, which is why it's important that not only do we diagnose it to help treat the horse, but some of these diseases, in particular West Nile, horses are called the sentinels of Ohio, which means if they get it, the Ohio Department of Agriculture, the Ohio Board of Health, they pay attention to that because if that's in the area, that means it can be affected. I actually had a horse that had this in Ravenna like 12 years ago when I first started. So 10 minutes from here, I had a horse that had that. So again, these things are real. They are around. They're not everywhere you look, but they can be there, and you don't know when they're going to show up, which is why you vaccinate. You know, these are, it's spread by mosquitoes, but actually, and much like the other encephalitis, it's actually, the birds are reservoirs. So the birds are actually get bit by the mosquitoes are what actually pass it to the horse. Now horses and people are what they call dead-end hosts, which means after it gets to us, it doesn't go any farther. There is enough of that virus to cause significant disease process in the animal or human, but it won't get passed on. So if a mosquito lands on horse A that has West Nile, it can't go to horse B and pass it. It doesn't work like that, which is a good thing. Let's see, again, I've talked about the vaccination schedule. Typically, it's diagnosed off of blood or tissue samples. Okay, my pictures kind of look like they show up. I keep looking at my little screen, so I'm not staring over there. I'm talking to you guys. Clinical signs. So pay attention to these neurologic signs that we talk about because then you'll understand what I'm talking about. Half of these look the same, probably more than half. You'll get hind end weakness, circling, muscle fasciculations, impaired vision or blindness, inability to swallow. They'll get hyperexcitable. They can become paralyzed, they can have seizures, they can have comas, and they can die. The one I had, I went and saw because they thought it was colicking because it was acting weird. Within 10 minutes of me being there, it fell against the wall, and they thought it was having a seizure. I think it was muscle fasciculations. And then it started getting a nosebleed, and by the time I got to go to my truck to get my endoscope to see if it hit its head and done something wrong, I came and saw it, and it was literally leaning up against the wall and couldn't hold itself up. I remember the girl said to me, though, on the horse, she said, how big are a horse's eyes supposed to be? And I thought that was such a weird comment. And its pupils were huge. It actually started to go blind in one eye. I got on a trailer. I got to referral center. By the time I got to the referral center, which was I sent it to Equine Specialty because it was close. It was blind in both eyes within a trailer ride. And by the next day, it was what they call tunded. It was basically down and was, for all intents and purposes, it had no life left in it. So they euthanized it. And that happened again within a day of clinical signs starting. When they started looking into that horse's history, that vaccine became kind of wishy-washy. And that's what I feel like when you hear about West Niles, you start asking about the vaccine. I just moved to the area. I can't find a vet. I don't remember if I really had it last year or not. So that goes back to my original point that if you do not stay up on these vaccines, you will lose the ability to help protect the horse against these things. So it is very crucial you do these. You don't get to do it like once every couple of years and you think you're saving money. You might be until they get that disease and then all that goes away. Treatment is typically supportive care, fluids, corticosteroids, because their brain is very angry in their spinal cord. Horses, if they can't stand up, they will use slings. Typically, as most of these neurologic diseases, if you have a horse that is unable to get up on its own and it's down, that is not typically a good sign. That decreases their prognosis when you're looking at them, because it means the disease is that far progressed. I kind of batch Eastern and Western equine encephalitis together. Again, it's a very similar thing to the West Nile. It's a mosquito-borne disease. Birds are the culprits of what are actually the reservoirs. Again, they're dead-end hosts, which means if one horse gets it, another mosquito can't pass it, which is nice. The big difference between these two is Tripoli is very fast-acting and very fatal. I think most of the numbers range between 60 to 80% fatality if they get this, where Western equine encephalitis is usually 20 to 30. And I think it was like 10-ish years ago. Didn't we used to have this up here, Dr. Paradine? Didn't we have that like 10 years ago? Mostly in Ashtabula, I think. Yeah, so there's a couple every year. So again, and you think of these things, you look at these numbers and be like, well, if only one had it in the area, and Sean just said that there's like all these horses around, that's not a big deal. But if it's your horse that gets it, it doesn't matter who else gets it or not. So percentages kind of go out the window, right? When you're the small percentage, when you're the minority, it's not great. So these can be diagnosed via blood tests, CSF taps, and there's a couple other ways, but those are the most common. But again, Tripoli is also known as sleeping sickness. Some people have heard that term before. They call it sleeping sickness. Clinical signs: fever, impaired vision, ataxia, head pressing is kind of an interesting one, paralysis, convulsions, coma, and death. So if I took that label off there and put West Nile, I just described West Nile for all intents and purposes. Treatment, again, supportive care, corticosteroids. I can only put so many horses in slings on slides, so just assume when we say supportive care, it's intravenous fluids, sometimes enteral food, use a feeding tube, things like that. And then if we need to, we put them in a sling so they stay standing. Because like I said, ones that are down, that's usually typically worse prognosis. Rabies. So as you see, there's a nice little red italicized thing on that slide that says zoonotic. So again, if you don't know that term, that means horses can give it to us, just like you worry about raccoons, bats, skunks, dogs, cats, foxes, all those fun animals. Luckily, the incidence of rabies is very low, particularly in Ohio. But again, like I said, it's around. Pennsylvania usually has several a year. And other states in the South will get it. It's carried from mammal to mammal. You don't just have to have a bite from another animal. If you have a cut in your skin and saliva gets on it, a scratch from that animal, in theory, brain material. So I probably wouldn't be messing with a horse's brain that might have rabies, or any animal, which is why typically, if it's a bat, you usually have to send in a whole bat. If it's a smaller animal, they want the head. If it's horses, they want the brain. So once clinical signs start with rabies, that's kind of it. Death is inevitable. It's just an unfortunate fact. It's just the way it is. It is obviously a very reportable disease in Ohio and the United States because of such a zoonotic potential. So again, going back to that core vaccine talk we had, number one, it's very fatal to the animal if they get it. But number two, we can catch it from the horses, so we have to be careful. That's actually what it looks like under a microscope. I always thought that was kind of cool. So what are the clinical signs of this? Ataxia and muscle weakness. So again, kind of sounds like one of those other ones we talked about a little bit. They can be sensitive to touch. They can have a lack of proprioception, fevers, if you can get close enough to take a temperature. They will sometimes self-mutilate. That's what this horse is doing here. It's actually biting its own legs. Now, there are other reasons why horses do this. So if you see your horse bite its leg real hard in the pasture, don't freak out, okay? But, you know, it's usually, I mean, it's almost insatiable. I mean, it's kind of like a zombie trying to eat something is what it looks like. But horses, like I've seen it in young horses that get separated from moms, they start biting for anxiety. If you get other neurologic issues, say you have a horse that has a liver issue and it causes problems with the brain, they will sometimes itch so bad they almost look like they're self-mutilating. So again, you know, this is to inform you, this is not to make you afraid. So don't see your horse rubbing its leg and call the doctor because he thinks he has rabies. Now, if it's the middle of the day and you see a skunk doing circles around your horse and then it's biting its leg, then you should probably call the veterinarian. They can become drooling, they can have trouble swallowing, which is a couple other diseases show that. Death, that's pretty straightforward. There's two different forms of rabies that horses can get. One is the furious form, so everyone knows the movie Cujo with the crazy dog. That's pretty easy to spot. That kind of goes with the self-mutilation, the aggressiveness. They can also get what they call a stuporous or paralytic or dumb form, where they just look like they're drunk. They're stumbling around, they're falling over things, they look uncoordinated, they just look neurologic. So again, all these diseases I've talked about for all intents and purposes, to some degree or another, look exactly like the same thing. So when you're in vet school, they always teach you that if you have a neurologic horse, it's rabies until otherwise. But luckily, knock on wood, it's not usually rabies. But you always have to be careful of that. Treatment, there is no treatment. If your horse is vaccinated, we usually recommend, or the state does, that you rebooster them very quickly if you're worried about it. And usually you're put in quarantine to watch to see if they get signs. If the horse was bit by a rabid animal that was confirmed, you kind of have two options: euthanasia, or that horse, I think, is typically isolated and quarantined for like 6 months and kept under observation. So again, it's important to have these vaccines on board. Oh, I found my piece of paper. So rabies was just in Tennessee and California. Triple E was in Florida and New Jersey. West Nile was in South Carolina. EIA was Canada and Texas. And then EHM has been Wisconsin, Tennessee, Indiana, Pennsylvania, Washington, and Michigan. So it's not just us. So you're not alone. I knew I'd find it eventually. Next up is equine influenza. So this is one of those kind of risk-based ones we talked about. But I would say that most veterinary practices make this kind of a mainstay because, you know, a lot of people around here are going to competitions, going to shows, they're traveling. Even if you're trail riding, going to someplace, there may be other horses there. Also remember, just because your animal does not leave the farm doesn't mean other animals don't leave the farm, so they can come back in and bring stuff. So most boarding facilities typically get the most common risk-based along with the core vaccines. So influenza, it's one of the more common respiratory viruses that the horses get. It's highly contagious or high morbidity, but typically it's a low mortality, which means it's very easy to pass around, but they don't typically die from it. That's what you want to have in a disease. You can get it from coughing, droplets, fomites. You'll see this word fomite mentioned a couple times in my talk. Basically, those are inanimate objects that pass along a disease. Your coat, the pitchfork, a bridle, a brush. Those are things that can transfer the disease from one animal to another. That can be diagnosed via nasal swabs, typically. Again, it has a high morbidity, so a lot of horses get it, but typically it's not something that causes mortality in the horses. At the racetrack, we had this every year. And people have amnesia for some reason because we would deal with it and be fine, and the next year it would happen again, and people would freak out, and then it would be fine, and it'd happen again, and they'd freak out, like every year. It was crazy. It was like Groundhog Day with a disease. It was kind of weird. Clinical signs, kind of a unique one to this one compared to EHV, which will come up soon. There is a lot of coughing that'll be associated with it. Not that horses that have other diseases can't cough, but this one in particular does. The virus affects the cells of the throat, which means they can get a bacterial infection on top of it, and that'll be important in the next slide. They'll get fever, nasal discharge, the cough like we talked about, lethargy and appetite loss. That's typically because of the fever. You know, if you don't feel good, you don't want to eat, you don't want to drink, and you're kind of lazy and don't want to do anything. Really, the way we deal with this is supportive care. You isolate, keep the horses quarantined, testing. We will put them on antibiotics sometimes. Again, viruses as a whole do not respond to antibiotics, But if we're worried about a secondary infection that's bacterial, we'll put them on antibiotics. Because what happens is a virus comes through, it kind of whomps out the body's white cell and its defense, and then it gives bacteria a chance to come back in on top of it. So you may end up with a viral infection and a bacterial infection because they're horses, so why only have one? I mean, that's kind of how they work, right? You guys still hear me in the back? Okay, cool. Okay, so the one that everyone's been here for and wants to know about. Truthfully, by this time, I'm assuming you guys probably know as much as I do after doing as much Googling as you've done. And don't look at me like you haven't done it, because you all have. So don't be afraid. It's okay. It's okay to Google. Just Google in the right spots. That's why I put those websites up there. So there are multiple forms of herpes. There's actually 5 of them typically that we could deal with in horses, but the ones that we vaccinate that are most important for us are EHV1 and 4, also known as rhinopneumonitis. So if you ever see rhinopneumonitis on a vaccine bottle or a certificate, that is for herpes 1 and 4. You know, kind of going with the trend at the moment, these are all viruses, so this is another virus. Many horses, depending on where you read, up to 80-90% of horses have already contracted herpes as a yearling or maybe a 2-year-old. So it's probably already in them. What happens with this virus is it gets inside them and it lays latent or dormant. And then under certain times of stress, it may flare up. And then that's where you get these pockets of disease, or I don't want to use the term outbreak, but you start to see cases of it. Outbreak's a strong term. Like I said, that number changes to 89%, but it's usually pretty high. You know, these horses can vary from subclinical, meaning they don't actually show signs of it and they're spreading it, to they're very sick, snotty noses, or on the far end of the spectrum, the EHM horses, the equine herpes myeloencephalopathy horses. You know, one, like we talked about earlier with the pneumabort, it can cause abortions, it can cause respiratory issues, and again, kind of the one we don't want to hear about is the neurologic form of it. It's spread via contact. You know, they say if they cough or spew in the air, it can travel like 30 feet. But again, those numbers vary. Probably another big way is just horses next to each other, because let's be honest, most barns don't have walls that are 100% secure between horses. They're slats for airflow. That's important. But in theory, that means things can be passed. And again, fomites. So a lot of times we're also the culprits, you know. I tell people, particularly when you have things like this going on, kind of keep to your own horse. You know, everyone loves horses here. That's why we're here. That's why we own horses. But it's not necessarily a good idea to go pet every single horse in the barn, go up and down the aisles. We want to, right? But you got to be careful, especially in times like these. You know, there are a couple different vaccines for it. It's diagnosed during a nasal swab, and there's a blood test that we can do. A lot of times we will combo that together. Clinical signs, this is kind of the interesting one about this. It has what they call a biphasic fever, bi meaning 2 and 2 phases. So what happens very early on in the disease, they will spike a fever, but then they plateau out and they're normal, but then they'll jump back up with a fever. So, you know, some of these cases of the EHM that we've had around here, people say the horse never had a fever. It's more likely they never saw the fever because they just didn't take the temperature. And not all horses with fevers actually act sick. I've gone to farms for horses that were just meh, just kind of being funny, and you take their temperature and it's 103, and a horse shouldn't be over 101.4. Other horses, they get like a 102 and they act like they're dying from the fever. So, you know, it's highly variable. So you can't just look at a horse and be like, oh, he doesn't have a fever, oh, he has a fever. But again, if you catch it in that kind of, that plummet area of that graph, you won't catch the fever. They'll get enlarged lymph nodes. They'll be discharged from the eyes and the nose, obviously. There's not much of a cough, like I said, compared to the influenza. Now, just because a horse coughs twice doesn't mean you say, oh, that's got to be influenza and not herpes. But again, there's not typically as much coughing. Treatment's typically supportive care. This one is, again, one we do biannually, so we do it in the spring or summer. You know, again, like we talked about, there are very good ways to test for this disease. But in this instance, it is not recommended to test for horses just because herpes is going around. Because like I said, horses already have herpes, most of them. So if you go looking for it, you're going to find it. So then the question is, what is the actual, how much should you trust that on? Is there a disease in a barn? Is there disease in a horse? So we like to pair it with clinical signs. So again, you know, I'm not saying you ignore it, but you just don't test. I truthfully was very afraid when all this started happening that we were going to get phone call after phone call of barns wanting the whole place tested. I actually think clients have been really good about that. I don't know if they were just educated or they were talking to their veterinarians, but we haven't gotten a lot of those. You need to come test my whole barn to make sure it doesn't have herpes. Because it's like, if I come test your whole barn, someone's going to have herpes. So again, the point of this is you have information when you go home, so you can understand these diseases more and what you should look for. So EHM. So again, it is typically caused by equine herpes 1. Very rarely equine herpes 4 can actually be a culprit. What happens is you get inflammation in the blood vessels of the brain and spinal cord, you get ischemia, you get blood clots, and that's how you get the neurologic signs. There are different forms or strains of this. Sometimes they're called neurotrophic versus non-neurotrophic. There's new variants. With technology, they're actually able to start to kind of sequence these things and figure out what strain it is to see what strains are maybe more, have a higher incidence of causing this disease. Like most of us have seen or heard from friends about cases around here, it's typically neurologic signs, and they typically start at the hind end. Now, they can be ataxic, stumbling around, but typically you'll notice they can't get up or have trouble getting up. They may have urinary issues, bowel issues, but they start to lose control of their rear end first, and it works its way forward. It is important to remember that this is a very acute onset thing. Your horse that's been having trouble getting up for 2 years probably doesn't have herpes. It probably has bad hocks. So again, an ounce of knowledge is very important with this stuff. So it's, I go and see my horse tonight and feed it. It looks okay. Louder? Okay, sorry, I drowned off. So it's my horse is fine tonight when I feed it. Tomorrow, oh God, it can't stand up and it's acting funny. You call the vet, and you go from there. Like I said, it's the acute onset's the big thing. Like I said, remember, our vaccines, 1 and 4, that we typically give you for the spring and fall, or even the pneumobord, if you want to include that, they do not protect against this disease because it's kind of a wild type. It's a different strain. They don't know how to predict it. And like I said, that's why I think they're doing more and more of the sequencing of the disease itself to see what strains really cause it, and we kind of figure out how to vaccinate for it. Because, right, that'd be the ideal thing. How can you vaccinate for this? But you can't at the moment. I've read some places that if you have a horse properly vaccinated, which you should in the first place, for just equine 1 and 4 in general, that can cause abortion and respiratory issues, that it may decrease the overall load of the virus that's being shed because they're already vaccinated for it. Now, I don't think that's a tried and true thing, but I've read that in some places. So, because I had someone the other day and said, well, I heard that the vaccine can actually help. I think that would probably be my way of interpreting that, is it may help with the shedding to some degree or the level of the virus in the body, but you are not going to prevent EHM from starting. Like I said earlier, this wasn't something we saw that often, and now there's a lot of it, but it's not just here. It's in surrounding areas in the Midwest, so we're kind of not alone on that. I think the most recent one I heard of was in Geauga County. I think that was last week, if I remember correctly. This one, again, they can, as we talked about with equine 1 and 4 in general, blood tests, nasal swabs, treatments purely, supportive care, fluids, sling if you need it, again, because these horses typically have problem rising, urinary catheters. It's a very intensive care situation. Again, once these horses are down and can't get up, it's usually not a good sign. There is some treatment that is being done using antivirals like acyclovir and valcyclovir, which are antivirals for herpes that a lot of times they use in people, but we will use in animals. I think the variability of their success is questionable, but I mean, if you're trying to fix a horse that has this, you're going to do whatever you can. So that is something that we use in our arsenal, but just because you start that type of antiviral in horses, it doesn't mean everything's going to be hunky-dory for you. Like I said, I know you guys are probably going to have more specific questions about this stuff, so we'll wait to the end because someone may answer your question and I can kind of keep going through the PowerPoint, which I'm doing pretty good at the moment. Tetanus. So now we're going to kind of transfer from the viruses more into the bacteria. I try to kind of keep these consistent with what they are. Tetanus, also called lockjaw. I'm sure everyone's heard that term. If you've ever seen a horse with tetanus, you understand why they call it lockjaw. You cannot undo their jaw. It is clenched and you can't move it. When I first started, I went out to a call that the guy said the horse had a blue tongue. And I was like, I just got out of school and I was racking my brain trying to remember what disease that would be. And I'm like, oh, there is a disease called blue tongue, but I think that's like in like goats or something. So that doesn't make sense. So I had no idea what I was getting into, but I figured it would probably be terrible because that doesn't sound like the right color for a tongue. When I got there, this horse did have a purplish blue tongue. What it had was tetanus, and its jaw had locked. I tried to open it for fun. You can't make the move. I don't care how strong you are. he was clenching his jaw so much the blood pooled in his tongue and it turned purple. Kind of like you put a rubber band on your fingertip, turned purple. That's what the horse's tongue did. Then after I started looking at the rest of the horse, because of course the first thing I noticed was the purple tongue, it kind of had certain traits that led me to tetanus. So like I said, this is a bacteria. There's a neurotoxin that causes it. So this is where those toxoid vaccines come in. So if you ever are purchasing a vaccine or you see your veterinarian pulling out a tetanus vaccine, it's called toxoid. They use the toxin to create the immune response to help the horse mount in a response. So it's not like a part of the bacteria, it's actually the toxin that it makes, which is a little bit different than some of the other ones. It attacks nerves controlling muscles, so they become very stiff or tetanic, hence the term tetanus, tetanic. Not contagious between horses. Usually it comes from punctures, wounds, surgeries, in theory, like a dental, if there's a lot of bleeding. And you got to remember, you don't have to have big wounds for this to happen. Yes, if you call it out and your horse cut their leg really wide open, it's very obvious, but a poke in the field, everyone I think as kids is like, oh, you stepped on a nail or you did something like that, you should go get a tetanus shot. Well, same thing for them. They may get poked by something out in the field, you don't know it, then they develop tetanus, which is why it's important to already have them vaccinated for tetanus. Trying to think what else there was. Kind of it. You can culture it, but truthfully, the clinical signs are pretty pathognomonic, which means when you see those signs, it typically means that disease. So what are kind of those clinical signs you see? They start to get really stiff. They splay out in kind of what they call a sawhorse stance, which you'll see a picture of in a minute. Their third eyelids, if you don't know that horses have third eyelids that will sometimes flicker. If you go by the stall, and I could do this with a horse if I clapped real loud, its eyelids would flicker like crazy and it would almost get like startled and tense up even harder than it already was. Their tail will stick out because, again, all their muscles are becoming very rigid. Again, the loud noises, lights that would make us excited makes it worse. They kind of have an anxious look on their face, like a grimace, because, again, all their muscles in their face are tightening. So it's like, you're trying to enjoy a conversation with someone. That face you make, that's what they start to make. Again, we talked about the lockjaw. Horses that, if they're not caught and they're not euthanized, usually how they succumb to this disease is respiratory failure. Their diaphragm locks up because your diaphragm is a muscle, you can't breathe, and that's it. So a couple pictures of what it looks like. You have that upper corner, you have the eye where you can see that pink kind of coming out. I hope you can see it. That's that nictitating, or that third eyelid kind of coming forward. Those other two horses kind of have that sawhorse stance. The gray horse even looks like it has its tail kind of stuck out. That gray horse is probably what the horse I saw looked like. And it was not vaccinated. Every year I see one or two horses that are not vaccinated for tetanus. And if you're not vaccinated for tetanus, typically you don't have a horse by the end of it. So again, for $13, it's well worth doing it. And most of these vaccines, these cores and these big ones for the spring, they all have tetanus in them. So I really implore you guys to do these. Horses like to find ways to get themselves in trouble as it is. To be able to prevent it with a simple shot is just infuriating to me as a veterinarian, truthfully, because it's something that I shouldn't have to deal with. And you shouldn't either as owners, and the horse shouldn't. So how do we treat it? We can give antibiotics, penicillins, there's some other ones, ACE, muscle relaxants. There is an antitoxin for it. It's actually not that expensive, but most people don't have it. I think you'd have to probably call Ohio State or something to see if they had it on hand. Most people just don't keep that because you don't see it that often. You used to see it way more back in the 60s and 70s. Again, as clients, you all have gotten more educated. You've cared more about your horses, and so the quality's better of the care, and so we have more vaccines, so it's not something we see very often. But when you see it, the horses aren't vaccinated, every one I've had. Because of that excitement factor, you do try to keep them in a stall that's dark and quiet, no loud noises, no doors opening, closing. If it is significant enough, they start to not be able to stand and you have to sling them again. So again, one of those ones where if they're down, it's not a good sign. Metronidazole is another antibiotic you can use. Again, it's kind of, you throw those things at it and I think you hope that it helps, but I don't know how much you really have going for you when they start to get in the advanced stages of the disease. Potomac horse fever is that one I mentioned a little bit earlier that, I don't think used to be a problem in this area, or maybe we didn't acknowledge it because we weren't looking for it, right? Sometimes things become more obvious when you start to look for them. But what it is typically it's seen in the late spring, into the fall, summer regions. But again, because good old-fashioned Ohio can't figure out what's due anymore for the winter, I know I had a horse last year that actually had Potomac horse fever in December, which is not something I usually would have thought to diagnose. So it's becoming more of a yearly thing, if you will, just because we're staying so temperate. They actually eat these cute little flies called mayflies that actually have the disease in them. They say that if you get Potomac horse fever on a farm, it's hard to get rid of. I don't know, because the places that have had it, I don't feel like are reoccurring. Maybe that's because they're vaccinated and they get it and they're not showing clinical signs, but I don't know if I agree with that. But I did see that on a couple websites, so I put it on there for you. No, it's an annual vaccine. You want to try and do it in the spring because, again, you're waiting for all the bugs to come out. It's really the only vaccine we have for this disease. I don't think it's necessarily the best vaccine in the world with regards to how well it works, but it's the only one we have, and I'd much rather have a horse vaccinated with this than not. So some of us have actually started vaccinating twice a year with this to try to keep your immunity up. And I think, again, as weather starts to change, that might be a bigger thing to do. It comes in like its own vaccine. It comes with other vaccines. I didn't really get into like all the different vaccines in the sense of the companies that make them, because that would be like a 2-hour talk. And since no one sponsored this, I wasn't going to kind of throw like one of them out there specifically, because truthfully, again, as long as you're vaccinating your horse, I really don't care what brand you have as long as it's working correctly. And different practices have different combinations that they use in different companies, so I wasn't going to get too much into that. As far as clinical signs, fevers, they can get colitis and diarrhea. They can get abortions if their mare is in foal, and they can also get laminitis. And usually that's the thing that you're trying to avoid, is the laminitis. That's what ends up getting them. Their feet kind of start to go and you're trying to deal with that. So like I said, when I was at Michigan State and you called in like in that certain times of year and you said, boy, I got a horse that's kind of acting with a fever and maybe it's got diarrhea, they literally just told that referring veterinarian to start it on some sort of antibiotic, which we'll talk about in a second. That's how prevalent it is. So with that, antibiotics is technically a tetracycline. Oxytetracycline is something that we can give IV. You can also use other drugs such as doxycycline, but usually we try to hit them pretty quickly with the IV stuff to get things going. Anti-inflammatories, there's inflammation going on in the gut. If you're worried about the feet, you got to start treating the laminitis, whatever that may entail. And sometimes just fluids, because with diarrhea, horses love to get dehydrated really quickly, and that leads to other problems. So like I said, most of these diseases, have you seen, fluid therapy and supportive care are usually a pretty big part of it. Strangles, another one that we've been having kind of an uptick in cases around here. It's always around. It'll always be around. It's a pretty ubiquitous disease. It's a bacterial infection that can get passed very readily between horses, so it's highly contagious or has a high morbidity. We can diagnose this via blood. You can culture it. You can do a PCR. So when horses do get this, we like to try to combo things, because if you do a PCR, what that looks for is any sort of fragment or DNA of this bacteria. Well, that might be dead, which means it might not really have the disease. If you culture it, you might actually catch it on a culture, so that might not help you. So if we really have concerns about this, we will do both of those, or sometimes we'll do guttural pouch flushes. I'm sure you've heard of, because that's where it likes to live. So you will actually try to go to the source, if you will, to try to get a sample. So there's more than one way to look at it. There are a couple different vaccines for this. Probably the most common one is an intranasal one, but there is also an intramuscular one. So there are two different kinds. There is always the discussion on this about should you or should you not vaccinate for this. It's one of those, as we talked about, a risk-based vaccine. We have 1 or 2 barns that I think require it, and so we do it. I've had kids that go to certain fairs that required it in the past, or certain venues. This is, again, something that probably a lot of horses have had at some point in time in their lifetime. So if you have people that are worried about it, one of the first things I'll have them do is run titers, which will test kind of like if the disease is there, how kind of strong is it in the body. If you had a horse that had a really high titer and you didn't know when you vaccinated for this, particularly with the intranasal, which is a modified live, you can make them really sick. So I kind of am a proponent of titers. I'm not saying that's right or wrong, or vaccinating for it is right or wrong, but I think that's one of them that does have some, it does have some discussion based on it. Now, if you're in an endemic area for it, maybe if after you do a titer, you might want to vaccinate for it. But there's a lot of discussion about that. Luckily, again, although it's highly contagious, a high morbidity, majority of the times it's not a fatal disease in horses, luckily. So fever is one of the more common clinical signs. Of course, the nasal discharge that everyone sees. They'll get those lymph nodes that swell and sometimes break under the throat latch, and other areas for that matter, but mostly in the jaw area, which is why they call it strangles. There are 2 sequelae that I'll talk about, one of them because it's a little bit more prominent of this. One is purpura hemorrhagica. The other one is something called bastard strangles. If any of you have ever heard of that term, it's metastatic, so it's fairly uncommon. but what happens is they will get abscessation of this bacteria in other places in the body. We actually had one last year that was in the 2 years ago in the abdomen. Did you too? Okay, so did you? Okay. So that does happen, but it's not common. If you look at the amount of strangles cases that there are compared to how many developed bastard strangles, it's low, but you should be aware of it. Treatment for it, this also has some discussion involved in it. So isolation is obviously the first thing. You've got a very contagious disease, they're snot, they're coughing, you want them away from everybody else. Antibiotics, this is where the discussion comes in. Typically, horses will clear this by themselves, and then they go on with life, and they have a good natural immunity from it from some time, for some degree of time. If horses start to become very sick, then you get lots of fevers, you're running into more systemic problems, that's when we start to use antibiotics. Penicillin used to be the antibiotic of choice for strangles. I don't use penicillin anymore. I just don't think it was used appropriately a lot of times. When people do use the intramuscular form of it, it's not usually given in the right dose, and it's not given the right amount of times a day, so I just don't touch it. Also, it can have reactions, and I had one, and once you have one, you don't do it again. So, ceftiofurs like Naxil or Exceed are one that are more available, and those do work well. Anti-inflammatories, as you can see down there, that horse had a tracheotomy. If the swelling gets so bad in their throat, it'll close off their throat. And if you scope them because you're worried about that, and their airway looks really small, usually we put a scope or a tracheostomy in there because it is easier to put that in there and let those horses breathe normal than have to put that in there when the horse is in respiratory distress, because that is a disaster to do. You can do it, but it's not fun, so it's easier to be a little bit proactive. So not every horse that has swelling in their throats are you going to put this in. But if, we're like, boy, they sound like they're not breathing quite right, they seem kind of funny, and we put a scope up their nose and their airway's tiny, we'll sometimes recommend to do this because, again, it's better to be preventative, and the horses are happier than kind of having to deal with that in the moment of the horse throwing itself around and being, oh God, I can't breathe. And that does happen. So that other sequelae we talked about was purpura hemorrhagica. It's a sequelae to strangles. They'll get swelling of the head, the neck, the underbelly. It's basically like an autoimmune response. It can happen with influenza too. They'll get like petechiations or broken blood vessels in their gums. They can survive this, and it's difficult to predict the cases. Anti-inflammatories, steroids, and antibiotics usually help, and they also sometimes need a tracheotomy. I had to put one in last year because it had no throat left. But influenza can in theory cause it, but you don't see that often either. Botulism, it's another clostridial infection, kind of like tetanus, but the interesting thing about it is it works the exact opposite way, which we'll talk about. It's mostly found in soil and decaying animals, so you don't really get this from wounds. I guess you in theory could because of the soil aspect, but that's not typically how you get it. Usually what most people think about is hay out in the field that's sitting there in the grass, so that's another common reason. It can cause something called Shaker-Foal syndrome. There's also multiple types of botulism, so only a couple of them affect horses. They can diagnose either have clinical signs, history, but there's no real blood work. These horses get flaccid paralysis, so instead of being tetanic and stiff, they look like a wet towel. One of the first things people notice is they can't eat, they can't do things properly, but they keep a normal mentation. They look happy, they're aware, they're alert, but they can't eat. They may have problems rising. They may get colicky because their GI tract stops moving. But again, they have that normal mentation. And kind of the crazy thing about it is what it does is it makes the respiratory system go flaccid, so your diaphragm doesn't move because it can't. It's just like a wet towel, and then you pass away from respiratory distress. So both diseases have the same end result, but in opposite ways. It's kind of interesting. It's actually considered one of the most lethal substances on earth, botulism. Treatment, there are antitoxins. Unlike tetanus, they are wicked expensive, so that's not always done. Supportive care, you've read of people putting them on mechanical ventilators if they're small enough, but again, that's usually palliative. The antitoxins try to block from further harm being done, but it doesn't stop what damage has been done, so that's where the supportive care comes in. They can survive it, in theory. Luckily, not a problem here. PA and other places, a little bit more common. Lepto, this is another zoonotic disease, which means you can get it from the horse. Usually it's passed through urine, so they pee everywhere, it might get kicked up, might get in your eye, on your hands, you wipe your face. So you can get infected via mucous membranes, your mouth, your eyes, nose, things like that. Even cuts, breaks in the skin. You can also ingest it. Sounds disgusting, but I guess that can happen. It's diagnosed via blood or other tissues. What comes with this is fever, depression, lack of appetite. Another big thing is uveitis. We had a farm a couple years ago that had a couple cases of random uveitis. We tested them for lepto and they had it, so we vaccinated the barn. One of the other things that can affect particularly is the kidneys. Those are supposed to be kidneys down there. I was told by someone they don't look like kidneys, but those are kidneys and they need help. They can cause abortion too in horses, and then that eye in there has uveitis. Treatment of this, antibiotics, there's different ones people use, tetracyclines and rofloxacin. There's a picture of gentamicin down there. If they have uveitis, one thing you can do, Dr. Paradine does it, you can actually inject the eyeball with genicin, an antibiotic. Yeah, that's what makes me, I do that same thing when she says she does that. It makes me quiver, but it works. It actually calms down the eye very well. So that's why I have a bottle of that up there. Okay, we're going to go off a little bit off the beaten path real quick here. So melanomas, everyone's seen the gray horses with melanomas. They kind of get those lumps in certain places, their tail, their sheath, behind their jaw, maybe by their ear, things like that. Sometimes they're malignant, sometimes they're not. They kind of happen at any age. Typically seen in gray horses. If they're seen in non-gray horses, that's not a good thing. They should not have those. That's a very bad deal. Like I said, these are a couple of pictures of it we normally associate them with. You can get them in the eyeball. I've seen that before. Typically, a lot of people see them around the tail, so that becomes a quality of life issue if they get real bad. They break open. There's like this black ooze that comes out of them. They're very easy to diagnose. So why did I bring these up? Well, there is a equine melanoma vaccine that's actually a canine vaccine. So it's dogs with oral melanomas. They figured out if we give it to horses, it can help hopefully staunch the progression of the disease or hopefully regress a little bit. If it's advanced, they don't just disappear, but it can a lot of times help. And we don't really have any good other reasons or things to do to help horses with melanomas except for maybe resect them, but there's only so much resecting you can do in certain areas. So I don't think we have volume, but I love this. So this is actually Dr. Paradine giving the vaccine. Did you hear that click from my computer, some of you? So it's kind of cool. It's called VetJet, I think. It actually uses air to propel the vaccine into the body. There's no needles. So the click you hear is actually air shooting out of the mechanism. And the horses, it doesn't really hurt them. They usually jump because of the noise. So all you do is you clip them, you scrub it up a little bit, we drop the vaccine and we give it to them. So I think that's kind of cool. So I don't know if a lot of people have seen that, so I think it's kind of interesting. We'll watch it again one more time. But there's no needles, no nothing. That's just straight air. Another quick one I'll go over is something that you see in the South called swamp cancer or equine epithiosis. It's a fungal infection where they get these nasty wounds in skin and bones in their GI tract, and they get these weird little things called kunker, not canker. Canker's the stuff in the foot. It's called kunker. It kind of looks like little pieces of coral that's like yellowish green. Thank God I don't have to deal with this up here. It sounds terrible. It's diagnosed with a presentation or blood tests. Cannot be spread from horse to horse, but they have a vaccine for it, which is kind of cool, and I'll talk about why I'm talking about this more specifically since we don't live in Florida. So these are some of the lesions that you can see on the face, on the side of the ankle. That's what it does to bone. So it's pretty nasty, right? Again, thank God we don't have it up here. But why am I talking about this? We don't have it up here. Well, another use for this vaccine is equine sarcoids. We don't really know why it works. This was a horse that I saw late last year that had these significant sarcoids on the side of its face above its eye, which makes it kind of a tough place to treat. You could see it was fairly widespread. It's probably about the size of my palm overall. And if you can see, there's a giant raised red spot kind of at the top, which was about the size of, I don't want to say a golf ball, but like it's about that big. And the lady had been doing a very diligent job of trying different creams and things like that, and it just wasn't working. And so we decided to try this vaccine. And when it works great. When it doesn't work, but you give it a try. So she still treated this thing topically with a product that we sell. But the big thing I think, was the vaccine. And that's what it looked like 2 weeks ago, because I went and saw it for regular vaccines. So I thought that was kind of interesting. There's kind of a new emerging aspect of vaccines in horses that they're already doing in people called autologous vaccines or anti-cancer vaccines. Basically, this is a form of immunotherapy. So you're using, you're kind of treating this animal with, and of course, a human, but in horses, you're actually using their own immune system to help them fight things. So the equine melanoma, along with that vaccine I just showed you, you can actually take samples of a melanoma, send it off to a lab, and they synthesize a vaccine for you. From how I understand it in my simple mind, what they do is they combine the cancer with a bacterial DNA, and they make a vaccine out of it. And when you inject it into the horse, the body recognizes that and goes to fight off the bacteria, but the bacteria is linked to the cancer, so it eats away the cancer. So it's kind of cool. There's a lab, I don't know much about it, I haven't used it, but I've heard people talk about it, called Torrigen. Apparently you can send them samples of melanoma, sarcoids, even squamous cell carcinoma. They will create a vaccine, and then you use it once a week for 6 weeks. I have no experience with it. I just have heard a couple people talk about this lab that does this, and that's the only one I could find. So again, it's using the own cancer against itself, which I think is kind of fascinating. Lastly, because it's springtime, Coggins is always a thing. Inevitably, people are like, why should I pull a Coggins? And it's because we told you to, and there's a reason is why. So it's also known as swamp fever. It's a lentivirus. The reason that I point out what specific virus this is, that is a very similar virus to HIV in humans or FIV in cats. And that's important because, like in cats and like in humans, you become chronic carriers of this, which means once you get it, it's always inside of you. You know, there is the potential that a horse could pass away from this. Some horses show no signs whatsoever. Some of them get anemia, they get depression, and kind of everything in between. But this is something that they can get. Horses, ponies, mules, donkeys, zebras. If you have a zebra, do not call me. Call somebody else. I'm not doing that. I've heard about how that goes, and it looks terrible. But they all can catch it, and this is a worldwide issue, not just here. But because it's persistent, we want to know about it. You know, the way that this is typically passed is by biting flies, horse flies and deer flies. In theory, I don't know why you would do this. If you stuck one horse's vein and used the same needle to do another horse, you could pass it that way, but that's a very terrible idea. Dental equipment could be another way in theory. You know, if you're doing dentals, horse may bleed a little bit to get the blood on it. If whoever's doing your teeth doesn't properly clean their materials and disinfect, you may get in trouble. There is no treatment for this. There is no vaccine for this. This is why you test for it. Back in the, I think again, like late 60s, early 70s, there's a 4% of this in the population. So it seems like a small percentage, but now with this surveillance program of doing it yearly, it's down to 0.004%. So, you know, we had a scare last year. There was a horse in Northeast Ohio that had a positive. Because what happens is your vet usually tests the horse. If it comes up positive, the state is immediately contacted. Like, they don't even involve us. They go straight to the state. They come back. They retest in a different manner to make sure that you really have it. There was one up here, but I think it ended up that the horse had come from Texas, and it's probably where it had contracted the disease. There are usually ones out west, and for some reason Canada always has them. I don't know why, but it's always on that website. I mean, not a lot, but again, going back to that, if you're the 0.004%, it doesn't matter about the other 99 point whatever percent that is. So yes, it kind of seems arbitrary that we do it every year, because I always get the comment, well, what if the horse gets bit tomorrow? I'm like, okay, what if it does? But at least you know it is now. And this program has obviously worked enough that we've gone from 4% to 0.00%. The other kind of unfortunate thing about this is because there's no vaccine, there's no treatment, and they're lifelong carriers, your horse has two options. One is it gets euthanized. Number two, for the rest of its life, it's quarantined and isolated at least 200 yards from any other animal. And again, donkey, horse, mule, zebra, whatever else you got that's in the equids family. That's because something can bite it and transfer it, and someone figured out that bugs don't fly that far, apparently. I don't know. So those are your only two options. So that's why we implore people to do this. Just kind of a quick thing on biosecurity and isolation situations. So number one, when in doubt, talk to your veterinarian, whether it's about vaccines, what you should be doing, what you shouldn't be doing. If you have questions about a horse in the barn that you own, call your veterinarian and talk to them, because it may be something that can be dealt with on the phone. If it isn't, then you have someone that is going to be involved in the situation already at the beginning of it, and they're not coming in the middle of it, because there's nothing worse as a veterinarian than walking into a hornet's nest of a situation, because you're trying to get everything straight and then try and keep going on with what's going on. You know, horses that arrived in new facilities, you know, if you can isolate them or quarantine them, that's great. You know, some people say 7 to 14 days. I've read 21 days. But let's be honest, logistics, not everyone has the space for that. Some places have an extra barn out back, and that's what they do. Other ones, they kind of make there's a stall in between, measuring temperatures to make sure they don't get fevers. So just kind of watching the new horse that comes in, making sure if they're coming into your farm as a resident, you know, do they have a Coggins? Do they have a vaccination program? Do they have a fecal? I mean, a lot of barns, that's kind of the SOP nowadays. When we run a large farm in Medina, and like when my wife said what needs to be on the contract, those things are in there. Those have to be I have to have records of that before you come into our barn to stay there and stable. Disinfecting is a great thing, but you have to understand the products and what you're doing. Bleach and alcohol products are the most common and easy to get. Typically, bleach is like a 1 to 10 with water, but organic material makes them not work as well. So you can't walk into your horse's stall that has a whole bunch of stuff in it and just spray it real quick and be like, well, job well done. That's not going to work. Same like if you do foot baths, if you're worried about kind of moving things around. If there's a bunch of dirt and sawdust and grime in that bin, it's not going to work well. So you have to strip stalls before you clean them. Now there are hydrogen peroxide based products like Excel, Rescue, and Intervention that seem to work better when there is organic material around. So just something to remember. If you are worried about something being sick, be conscious of your footwear, wear foot protection, wear protective clothing. If you have a situation where something is sick in the barn, you treat it last when you clean it. You use its own set of sawdust forks. You don't use the same sawdust forks and then go back to that stall. So again, they're very simple things, but you just have to think through them in the beginning and then make a plan. And that's what most of the stuff is. If you do have a horse that's sick and it comes down with something, do serial testing. If you have strangles, there are guidelines and things that you can do with regards to isolation, how often you test them, how long is the barn locked down. A lot of that gets taken over by the state depending on what the disease is, but sometimes the private practitioners have some say in it. So a lot of it's just being conscientious. Again, we all love horses. Don't go walk down the barn and touch every horse's face one at a time. It's not going to work well. Don't let somebody else's horse nuzzle up on your jacket if it's got a snotty nose and then go to somebody else's horse. That's that fomite thing we're talking about. You just became the carrier for the horse. So again, just use common sense, especially with things going on right now. I'm not saying don't pet horses, but particularly when you have situations like this going on, just be careful. So with that, which was kind of a lot at the end, I will try to entertain questions. No questions? Perfect. Go home.
What is the difference in the vaccines versus what you want to purchase versus what you, and I'm not saying to eliminate the value, but I'm just saying.
Yeah.
There's quite a variation.
Yeah, yep, I remember that. Yeah, so the question is what's the difference between the vaccines that we give and the vaccines that you can buy at Big D's, TSC, other places like that? The answer is none. What it comes down to is those assurances that we talked about. If a horse has a severe reaction, if the horse needs tested in some cases, or if the horse contracts the disease and requires treatment, a lot of those companies will have some sort of warranty or assurance to cover you. Like BI is a big one. They're really good about that stuff. And they want to know about reactions. If your horses have severe reactions, you tell the vet or contact the company because they want to know about that stuff because they want to make sure they improve their vaccine. But to answer your question, nothing. But what you're paying for is the assurance programs and the warranties because vaccines have to be kept at a certain temperature. So all the vaccines we have at our clinic, and I'm sure they know they do it here, they have thermometers to make sure their fridges don't get too cold or too hot. Some people think, oh, you don't want the vaccine to sit out for a day because that's not good. If it gets too cold and it freezes, that's not good either. So how do you handle the vaccine? Did you give it correctly? Did you give the right amount? I get that all the time. I got a small pony who probably only need about half of it. No, you don't. It's not a dosage thing. You don't do it by weight. That is the amount of a vaccine that these companies have spent a lot of money and time on figuring out that the immune system requires to mount a response. So immune systems, you think about, they're all the same size. Doesn't matter how big the horse is, the immune system's the same size. So it's not a dose thing. Your mini pony doesn't get a half dose of things. It gets the full dose of everything. They'll be fine. I promise this is how it works. But you're getting the assurances is what you're getting. I think to add on to that, I think you continue a relationship with your veterinarian. Some people, God bless you, that don't have problems with your horses don't have to see us that often. So it's once or twice a year for vaccines, dentals, fecal sheaths, and Coggins. So maybe you just don't really call us and you're there and you think, oh, you know what, that horse had that weird thing in its eye and why they're here, can you look at the eye please? I have that happen all the time. We're there for doing these simple routine things and people go, why you're here? Or I just remembered. It sparks them to ask questions. So there really isn't. Again, if we can do it, that helps you out on the backside of it. In the end, I need your horses vaccinated, truthfully. I mean, again, if we make the money, that's great for us. You get assurances, everyone's happy. But in the end, I need your horse to be vaccinated. Because like I said, Euthanizing horses for things that can be prevented is extremely frustrating. Like we talked about, horses love to find ways to get in trouble anyways. We need to try to limit that risk. So that's why good old Ben was up there in the first slide. That's why we vaccinate, prevention. So there is no difference. They don't get different vaccines. It's
Some people talk about it, just do it yourself kind of thing. I like the relationship.
Yeah, again, there's pluses and minuses, and you're paying for that. When people talk about the cost difference, you're paying for that. But there's also our professionalism, our ability to give a shot correctly. Not that people can't give shots, but you're paying for those things. But again, your insurance gets wrapped up. And a lot of those companies are very good about that. BI just sent out a whole bunch of things about their insurance assurance programs about that stuff. But you have to have, the vet that did it, a certificate, because they have to know it was handled correctly, is probably one of the bigger things.
I've got horse out west, a 3-year-old, and I was checking prices and what I'm gonna do about that. And there was a huge variation in prices for the vaccines, which one of the reasons I was asking.
Yeah, that happens. And what they include, I think we're talking about, I think some of these still have Venezuelan in it.
This was the 6 week.
Okay, yeah. And that's it. But like some of them have things that you don't necessarily need, like the Venezuelan. We don't have a problem with that anymore. It's a pretty wicked one. It's a lot like Triple E. It is a high fatality rate. And the real cheeky thing about that one is two things. Number one, rodents are also reservoirs. And the other one is that one can get passed from horse to horse. But that's more Central and South America, thank God. So, good question.
Before you move on, add into so if we're seeing your horse is not the vaccine prone ones that
Oh, yeah.
most vet clinics, because there is a shortage of equine vets right now, are only seeing emergencies for their existing clients. So if you're not getting that preventive care, you might not have access or easy access to a vet in the middle of the night when you need it. Horses colic any time of day.
Yeah,
And so
that's a good point.
sometimes maintaining that relationship.
Yeah, a lot of practices currently, most of them right now, I would say on the whole, are not taking new clients, particularly on emergency situation. It's not that we don't want to help you all's horses. It's the problem is there is so many horses and there's becoming less and less vets. We get a lot of calls because we're a big practice. They're like, well, you have 9 doctors. We have 9 doctors because we have 9 doctors worth of horses. We didn't hire all these vets and go, I hope we get some people. Like, we keep hiring so we can keep up with y'all and all your horses, which we love that you're buying. But yeah, that is part of that relationship, that you have. Because again, when I get 4 calls in a night and one of them's a non-client, you get triaged. It's just how it goes. It goes clients versus non-clients, and of the clients, what's the severity of those things? That's just how it works. It's just legitimate triage. So it's a very good point. Let's go to you next, and then we'll go to you guys.
In the present climate, knowing about this virus, even though all the shows and clinics have been canceled around here, if you're showing up to go on a trail ride with a buddy from another farm, and you just don't touch each other's horses, are you pretty safe? Yeah,
I'm not going to say you're not going to contract it, but the less contact, the better. I know it's a scary time because a lot of people are kind of buckling down, and I understand that. I get that. And the big issue, particularly with the neurologic form, as you guys have seen if you've been tracking it, is there's no real ties between most of the horses. Maybe a couple, and the initial ones maybe have been tied to a certain location. The Holmes County one, that's nowhere near here, the Wayne County, whatever it was. The Ashtabula one, I know, is an Amish horse. So that had nothing to do with those other horses. The one in Portage County, again, had nothing to do with the other horses. So it's kind of sporadic, which is kind of the other thing, which makes it a little bit more difficult. A lot of times, not a lot of times, but sometimes when you see these pockets of EHM, it's at a show. And multiple horses at that show have it, and they just lock down that show, no in or out until they deal with it. But this has been kind of interesting because it's a little bit more spread out. And again, as you heard, there's also a lot of states more or less in the Midwest that have it. So it's not that you can't go take your horses places. Some places probably just from a liability standpoint just don't want to risk it, right? You can take a hit as a business if that comes down in your place, or even a barn. That's hard on a barn, right? If your barn gets it, that's hard. So yeah, it's not to say there should be a quarantine, you can't take your horses out, but I think you have to be intelligent about stuff. Look how many horses were at Chagrin and that one got diagnosed with it. How many horses were there in and out? So. All right, gentlemen in the vest first.
Best injection site.
For you or for me? So the three main places you can give a vaccine typically, one is in the neck. The pectorals are actually great areas because they're big muscle groups. In the rear end, I don't do that one. I spend my day trying not to get kicked as it is. I feel like the more I can limit that possibility. The other legitimate, serious reason I don't do the rear end as much, and it's a totally acceptable way. It's on all the websites, AAP, everyone tells you how to do it. If you have a reaction or an issue from that, that is not a fun place to work for two reasons. Number one, your horse doesn't want you doing things on its rear end. Number two is the muscles where you typically put it are kind of like your hamstring muscles, so from your butt down to your knee, right? Those muscles run vertically. And I'm telling you this because I had this happen. I had a client, horse got vaccinated in the rear end. No one did anything wrong. It came down with a clostridial infection, which is very nasty to have. And it was very difficult to treat and deal with because what you want to do with those is open it up, get air to it, clean it out, and make it better. It literally ran up and down the horse's leg in between all the muscles, the fascia. So it was so hard to deal with. In the neck or in the chest, if they get an infection, yes, if it's in the neck, inferior by your spinal cord, but typically we do it in a place not right next to it. So I think they're easier to treat. But those are the three typical places that I would say to do them, which is two. But people do it all the time. I don't want to sound like a chicken, but like I said, half my day is not getting kicked. So like if I can decrease that chance, it's way easier. Question.
Okay, with the herpes virus that's going on, how do you know when the coast is clear?
Yeah.
How do you know, we like to go places to shows and sorting practice and things like that. How do you
Yeah.
know when it's-
Yeah, good question. And I don't know if there's you can go by how long the virus lasts and things like that. Sometimes environment, they say up to 30 days. Other things say they usually don't last that long typically. For me, I was kind of getting excited until that last Giago one popped out. Then maybe we were kind of getting away from it. But you figure I would say you probably have a month probably of no real cases because by that time you should have seen one. Now, these are reported, right? Things can happen that people don't report. Maybe the horse dies acutely and so no one did anything with it, So there may be cases we don't know about. Those ones that we talk about, those 7 or I think maybe 8, those are because those were tested, the state got involved, private veterinarians involved, and now we know about them. So I would probably say a month. But again,
Like from now?
probably from the last case, because I kind of look at it like a quarantine situation in a barn. You want to go from the last clinical sign or horse that tested positive. But again, it is spread out. I agree that it's not becoming a lot, but we've had quite a few considering. But it also, I think sometimes this stuff travels in cycles. We may not have it really for another however many years. We may have more triple E next year or more influenza or something like that. But I think a month is probably something to go by. But facilities are going to do their own thing too.
Yeah, I don't allow.
Yeah. And some people are doing that right now. But yeah, I think that's a good question of, when do you say the coast is all clear? And there's probably not a great answer for that, truthfully. But I would say 30 days. Yeah, it's really never, which is why we tell you to vaccinate, truthfully. Yeah, because it might not be this. Maybe it's strangles, maybe it's triple E, maybe it's...
Well, this is so scary with the neurological.
Yeah, it is for sure. And the more scary thing is because we can't really prevent it with regards to vaccines. And a lot of times the outcome is not ideal for the horse, unfortunately. So, yeah, I get that. But yeah, as Dr. Paradine said, that's probably a good comment. All right, someone over here. Yes, ma'am.
So regarding the neurological diseases like PHV1, EPM, Lyme,
Yep.
of the horses that do contract them, are there any common threads that make one more susceptible? Because I know things like Lyme, EPM, a lot of the blood work will hit on it, but they don't always have the neurologic symptoms.
I will. I'm trying to think about. Explain that one more time. My brain's trying to figure it out. Easy, everybody. Easy.
So in the case with Geauga County,
Yeah.
the EHV, it said
Yep.
there was 25 horses exposed, just the one died.
Correct.
Is there something that is underlying with any of
Yeah.
that?
So her question was specifically with the age. Sorry for not understanding the first time. I get it now. A little bit slow on Saturdays. So her question was particularly with EHM right now. Where you have these facilities where one horse has it, but 25 other ones don't. Is there a common thread? Is there an issue? Some research says females get it more than males. Usually it's older or younger animals. It's just kind of like us. If you're kind of in that middle-age bracket, you can usually fight things better. But again, particularly with that neurologic form, it is really unpredictable. And that's the sucky thing about it. It's unpredictable. And because we don't have a vaccine, there's no way to kind of stave it off. Luckily it's not, usually a very common thing to run across. And there are the respiratory ones. If you check that EDCC website, there have been respiratory horses, not in Ohio. So you will see the respiratory form, but there's not really a good linkage. Again, they will kind of discuss predisposing factors, real young, real old. But yeah, there's not like a, oh, this is why. But, you know, like I said, luckily that's also the thing is most of those places that have had it has only been one horse. So, and that just shows you kind of how unpredictable and difficult it is to, because, you know, one has it and no one else does. You know, that one in Geauga, I don't know where it is, but in the most recent Geauga County, there's 25 horses that are considered exposed and under quarantine, but only one horse had it. And it may stay like that until the quarantine's lifted. It may just be that one. Yes, ma'am.
Going down to Equine Affair, so if you're safe and you keep your horse sheltered, you have to test a couple days before you take the horse down to make sure for your, temperature and such. Good idea, bad idea, it's 3 weeks away, it's,
Yeah, I mean, 3 weeks away is, if nothing else pops, I think, again, you're never in the clear, but again, the farther away you get, the better. I think being vaccinated in general is good. They've done research in people, humans, that there is some suspicion or thought that when you vaccinate, although you're only vaccinating for certain diseases, you're amping up your whole immune system. So by doing that, your whole immune system is on a little bit of a higher alert. Now, it doesn't mean you have antibodies to these other diseases because you haven't seen the diseases or gotten a vaccine for them. You don't have specific antibodies, but hopefully your body's a little bit more on awareness. They did some studies, I think specifically in Africa, where giving vaccines to children that died of certain diseases very early helped increase the lifespan of those children and drop the fatality rate of young children in specific diseases that they vaccinated for, but then other diseases that also used to affect them, they also didn't get as much. Now, was that because the child wasn't weak in general and couldn't contract the other ones? Again, so going back to, is your immune system being ramped up good for you in general? So I think that's another point of why still being vaccinated appropriately, even though you can't vaccinate for that specific thing, is important. But yeah, I mean, I think the farther away you get is the better thing, yeah. So again, kind of going back to the other question, there's not really a good answer, but again, the farther away you get, I think the better you are. But you never know. Who knows? It may go 6 months, all of a sudden one pops up again.
yeah, and then the other question was, if it's only a week out that you get your new vaccines versus a 3 weeks.
Yeah.
So they've been vaccinated regularly, but there's a
Yeah.
window of,
Yeah, so the question is if if it's only 3 weeks away, or it's only 1 week versus 3 weeks after, because I think you're talking about my comment I made earlier. Mm-hmm. Yeah, so that's more of like typically the initial, specifically the initial. Once you have to get 3 weeks out from that, yeah. That's why, again, it's so important to keep up on your vaccines. Back to your question about the veterinarian and stuff like that, the assurance programs typically run out after 365 days from that vaccine. So if you get a West Nile now from a veterinarian and 366 days from now your horse contracts it, you don't get anything from them. So again, it kind of keeps that thing going. You need to see us continuously, but also keep your vaccines up so they don't kind of fall off, because they will fall off. That's why I said horses, if you don't know, just pretend they've never been vaccinated. You ain't going to kill them. You're probably going to save them. Yes, ma'am.
Now, with dogs and cats,
Wrong talk.
I know.
Yeah.
Usually they get to a certain age and they'll say they don't need vaccines anymore.
Yeah.
I mean, except for the rabies. But for horses,
So the question is particularly with small animals, sometimes they will say they phase out of ages they need to do vaccines. I think in horses, I don't think we typically fall by that because they're so susceptible to so many of these things. Again, like tetanus and stuff like that. Again, I think like the core we talked about, I think is probably the big thing. Because again, those are things that can get your horse at any time, whether it's in a barn of 100 horses or it's just got one buddy out in a pasture that's never gone anywhere. So I always try to keep the core going. If you're going to drop off, it's the risk-based, because you're probably not going to have to run that much if you're kind of sequestered off. But again, you probably get some increase in immunity in general from being vaccinated. But the core I'm usually pretty hard on. I'm pretty big on doing cores all the time. Again, zoonotic diseases, if they're not vaccinated, sometimes they don't get good choices in what they get to have happen. And so I'm always a big fan of the core at minimum. But that's a good question.
So
You're next.
the herpes and like the strep and that, because the horse is usually contracted and it's kind of in the latent phase.
Strep, you mean as in the strangles?
Yes.
Okay.
So is it basically that you're going by clinical signs? Because if you test for that, they could test for strep or herpes, but it may not be
Yeah.
active. And can they
Yeah, and
They're carriers, can they
yeah,
be
so there's
spreading
discussion
it?
of carriers and can they spread and testing and things of that nature. So again, most horses for the herpes have probably already had it. So if you just test for it, you might find it. But if I go see a horse that has a snotty nose, nasal discharge, eye discharge, that's probably going to be on my list. If I go see enlarged lymph nodes and the snottiness, you know, especially if they're young, strangles is a lot of times seen in younger horses, I'll probably be looking to test. But again, that's where a lot of that paired testing going on, doing a culture and say a PCR or a nasal swab of things or a guttural pouch flush, I think is important. The other thing is if you get strangles vaccines and you try to pull like a titer, it may pick it up. Also, that may play into a PCR, which again looks for the disease, whether it's dead or alive. If a horse has been vaccinated, particularly with strangles, and you do a PCR test, it may still technically pop. Now that DNA may be dead, it may not be doing anything, but you may still have it. That's where it goes back to always talk to the vets and figure out a plan of why you're testing and what you're testing for. A nice thing that a couple labs have is a respiratory panel. So it's kind of nice. So it tests for like 4 or 5, depending on which lab you use, different respiratory viruses. So a lot of times we do that. You know, it's really easy right now because there's the herpes going around. There's the strangles that assume that everything is herpes and strangles. I get that, but it's fortunately usually it's not. But you have to be aware, right? Because it still keeps popping up. So I don't know if that answered your question specifically, but and some are
Well, I'm a nurse,
subclinical.
so
Yeah.
I'm going
And
by
some are
human
subclinical, so
stuff.
you don't know.
Right.
I mean, that's the problem. Some fly under the radar. Again, like with the herpes, you may catch it kind of later because of fevers or some of the earlier signs. If you don't catch it on that biface, you know, where they're peaking at their fevers, you're not going to know. I mean, I think people right now are taking taking temperatures more, just to be aware of that. But also, just because you have a fever doesn't mean it's one of those. This is the time. I usually tell people if people are getting sick around you, horses will follow and horses will get sick. So like kind of like in the spring and fall, everything gets sick. The horses do the same thing. Get calls for fevers and not acting right and not eating and yada yada. So a lot of that stuff is just your everyday crud. But yes, now you have to be a little bit more conscientious of what's happening.
And with that gentamicin where the other vet injects it, is
Crazy
there
one back there.
eye drops? I mean, or is that not a
Yeah, there's eye drops, but that's not nearly as scary. Yeah, there are, and for horses that have chronic issues, if they're quiet, they actually can put cyclosporin implants into the eye that slowly release. The problem with the implant, correct me if I'm not doing this right, the implant, if the eye is not quiet already, they will not put them in. And it's also more expensive. So this vitreal injection of gentamicin works very well, and you can do it when they're in a flare. It just hits harder. But yes, there are topicals, oral.
With the drops, it's really surface treatment with drops, whereas the disease is within the eye. So you don't get good penetration of the antibiotic into the eye. There are some times that we'll use systemic antibiotics to treat uveitis in conjunction with other things. But the key there is by doing the intravitreal injection and literally sticking a needle into the eyeball itself, you're getting high concentration in that area.
Yeah, she does that. I don't do that. I'll put needles a lot of other places. I'm not putting them in eyeballs. I don't think so. Tammy. Oh, you go first. Nope.
So these, boarding stables
Hmm?
with like 25 horses.
Yep.
Nobody's allowed to come in, nobody's allowed to go out right now. But there's a discussion on, should we do the bleach foot bath and the hand sanitizer, everybody that comes in? If you're having a chiropractor come in, and they did multiple horses that day, even though they say they're not going to infected barns, should they sanitize? I mean, we've got the horse thing down, but what do you do?
Yeah. So her question is kind of on, you know, we've kind of figured out what to do with horses if we think they're sick and things like that. But again, the big question mark is us as people, vets, farriers, chiropractors, massage therapists, MagnaWave, and everything else in between. You know, nutritionists walking in and out of barns. Yeah, I mean, and it's a real easy rabbit hole to go down, right? Like how intense do you get about it? You know, I think good hygiene. You know, we make sure we know if we're at barns that have something that's infected, yeah, we'll change clothes and do things like that. Again, we try to only work on the horses that we need to when we go in barns. I think that helps. I mean, there's not really a standard for that. I mean, I've heard of a couple smaller barns that they're kind of stripping stalls and kind of cleaning once, and that's great. I don't think you necessarily have to do that. I think it's a lot of in what your purview of what you're comfortable with and what you want to do. I've heard kind of the gambit. You know, some people won't let anybody in the barn unless it's an emergency, and other people it's kind of just, you know, business as usual. So I don't think there's a specific answer for that. But I think when you do those things, do them correctly. So again, if you're doing foot baths, that's great, good for you, but make sure you clean that thing out every day and redo it. If you're cleaning stalls, get all the stuff out of there, the straw, the sawdust, everything, and then spray them down, particularly if you're using like bleach products or alcohol, because if you've got a bunch of sawdust and stuff everywhere, it ain't gonna work. So I think that's the bigger thing, is when you're doing it, do it right and be consistent with what you're doing. So. All right, I know you were waiting for a minute.
On the titer,
Yes.
for the core vaccine diseases,
Mm-hmm.
is there any way you can titer for those, like you do for strangle? I have a vaccine reactive for, it gets like 104 or 105.
Yeah, those ones. Yeah. So her question is, can you like titer other things out, like we do, like say strangles is a big one we pick titers on, because she has a horse that one of the more rare ones, but it has severe vaccine reactions. Number one, do you like pre-medicate?
We started, and then because it was like lasts for 3 days, then it's like you're running out of the window that you really want to have on Banamine. So I just stay 24 hours and check the temperature and eat something.
Yeah, so a couple thoughts to that is, you know, number one, try different combinations, try different companies, because sometimes it's the,
Had some luck with that.
okay, yeah, so to go with their question, sometimes it's you're not allergic to rabies, they're not allergic to West Nile, it's other things in the vaccine typically are what they call the adjuncts, the other things that are in there. So sometimes switching companies will help because some companies may have slightly different things within their vaccines. Pre-medding is another thing that I asked her about. I got horses at my wife's barn that always have reactions, so we always start giving Banamine. Truthfully, giving Banamine for like 5 days or so does not scare me, and probably in my mind, truthfully outweighs the risk of what may happen. Now, if you can kind of isolate specifically what vaccine that you're getting, that may help. Like, to me, 5 days of Banamine versus potentially getting tetanus or one of these other diseases, I'll roll the dice.
We had less of this
Yeah, yep,
spring last year, so I'm crossing my
yeah,
fingers.
yeah, so roll with that. But my thing is, again, I'll roll the dice. I'll take 5 days of Banamine any day of the week. So,
Can I just add something on to like
Yeah.
part of her question? Because you were asking specifically about titers.
oh, yeah, I didn't really, yeah.
It's really expensive, yeah. I mean, you can.
Yeah.
You can do it, but for some of these diseases like rabies, there's no established peer-reviewed level, acceptable level of a titer, right? So you'll get a number back. Is this protective?
Yeah. So,
And the big question is we don't know.
Yeah.
Some things like strangles, we do have kind of a level that we are comfortable with, but some of these diseases we don't.
Is there research going into any of that, or?
Not enough.
probably
Everything, right?
that, and probably for them it's easier. I mean, again, not to belittle your situation, but the majority of horses handle it well. So, I mean, but I understand. It sucks when you do have one that has it. I've had some in the past. It's super frustrating. I get it. Listen, so I'm not trying to belittle your situation. So I agree. Yep.
Sean, on top of that one, they do make vaccines that have all your core vaccines in one dose. So in theory, if you have a vaccine reactive, you may just react to every vaccine that it sees. Maybe you minimize it by saying, okay, we're going to give that one vaccine,
Yeah.
has everything we really need. We're going to go through that 3 day of terrible fevers and just be done with
Yeah.
it instead of multiple.
Yeah. Especially in your case, yeah. Just do it once. You know, cry once, buy once. Just do it and be done. I mean, it's probably a terrible way to say that. You know, but other horses do better if you spread them out, because if it's more of a soreness issue, we spread out the vaccines. Some people spread out because, again, you can get vaccines. It's like a buffet, literally. You can get them in any. I mean, there is different sets. There's 5 ways, 6 ways, 4 ways. Ones that have one thing, one that don't have other things. Some go intranasal, some can go IM, and in different combinations from different companies. I mean, you could literally probably give 7 separate shots to a horse if you wanted, because you can break down the vaccine so easily. But again, that's not economical, and it's probably just kind of harder on your horse, truthfully. Yes, ma'am.
So my question is, we discussed that with the herpes virus, that it was transmissible through fomites.
Yep.
The question is, do we have any understanding of how long it's stable on a fomite in the environment? If you
Yeah.
were to barn 1 week, 2 weeks later, or should probably be okay, or should we still like disinfect?
Yeah. So it's again. So it gets kind of variable. You know, like I've seen 3 to 7 days is probably the more common. It may live in the environment. luckily most of these things don't persist real hardcore in the environment. But I've seen other things that say I'll use the term ideal environment for them, not us, it may last up to 30 days. I think that's probably not as typical. I think once they're in the environment, they probably have a short life of living there before they get it. So, but I mean, I think maybe washing, say, your jackets and things like that once a week aren't bad ideas, or things that more commonly come into contact. Maybe washing your boots, spraying them off, stuff like that. Yeah, it's highly variable, but I think that'd probably be a good way to go about it. Like I wash my work stuff. It's also usually gross by the end of the week, but like my jacket and vest and whatever else I wear usually gets a washing once a week. So yeah, you could change jackets if you want. Just be conscientious. Again, limit, like we do, limit contact to what you're doing. In reality, unless you're working in the barn clean stalls, you shouldn't need to be coming into contact with every horse anyway. So don't make yourself come into contact with every horse, especially now. Again, like, come on, let's be honest. In 5 months, probably everyone's going to be touching each other's horses again. We're going to do it. But yes, Tammy.
I just wanted to thank you for doing this and helping understanding of all this, you and the Cleveland Equine. Thank you very much.
So Tammy was very nice and thanked us for being here. You guys got any other questions?
For the lepto,
Yep.
why don't we vaccinate the horses for it all the time, but we vaccinate dogs for it?
It's not as prevalent, particularly in this area. It is wicked and it is zoonotic, so it's a problem for us. I remember when I was in vet school on emergency, I had this super mean dachshund. Like there's nothing weirder than like a mean wiener dog. It was ancient, it had disgusting teeth, and it had lepto. And so they would catheterize it to control the urine because that's mainly where it's passed. So like you had to change the bag on this ignorant little dog every day. It was like a war between not getting bit by it and not getting infected urine on yourself. It was terrible. Sorry, that's a sidebar. His name was Scrabbles. I did not like him. I remember his name. It's not good when you remember the name. They're either really good or really bad. It's just not as common. But again, that's why that's kind of that risk-based list. There maybe are, and I'm just not familiar, more endemic regions. Or again, like that barn we had that had a couple uveitis all of a sudden at once. We're like, well, that doesn't really make sense. And we kind of came across lepto. Kind of like the botulism. There was a farm a couple years ago in Medina that had it, and we vaccinated. But we really don't have that often. Now you go into other places like PA, it's much more common. It's higher on their list of things to look at. Yes, ma'am. You got all the good stuff in PA.
Yeah, so like I have the resources that you gave us, but then like my girls, they want to show with 4-H and go to clinics or the fair or riding meetings, and so we're kind of like, whoa, we're taking a step back, and you said to see the like the outbreaks in Ohio.
Yep.
How does that transfer to PA?
Yeah, I mean, so again, I think you guys still follow that kind of core vaccines, flu, rhino, and then the Potomac. But again, like one of our doctors in our practice, the question is because she's in PA, what should she be doing differently, especially traveling from PA to Ohio, etc. I mean, I think you do kind of our similar thing is what I would recommend. But again, depending where you are in PA, botulism may be something you should have on your list. The one doctor that's in our practice in an internship in Pennsylvania, and she said it was almost like a core to them. Like they just put it, every horse got it, because again, it's such a debilitating disease. You'd rather kind of, again, the ounce of prevention, right? So I'd rather do over than under. So good question.
Do you have a list of core fall shots?
Yeah, so her question, well, do you want that to be more just a